I'm Dan Collins with Mercy Medical Center in Baltimore, Maryland, and you're watching Medoscopy. Medoscopy, taken from the suffix oscopy, to view, to examine, typically with a scope, as we do through the camera lens. Med, short for medical, as we will endeavor to examine all things medical to educate, engage, and enlighten. Today we're speaking with Dr. Ashanti Woods, a board-certified pediatrician with Mercy Family Care Physicians. Dr. Woods, thanks for joining us today.
Thank you for having us, Dan.
No problem. Dr. Woods, we've worked for a few years now on all manner of different topics, as our viewers can see on screen, everything from tummy time to the Benadryl challenge, and of course now a lot of stories relevant to children and COVID-19, a whole gamut of different topics. One topic that received a lot of attention was on Mercy's Woman's Doctor program concerning kids and high blood pressure. I've read that 1 in 5 children has high blood pressure and that pediatricians are screening for it as early as the age of 3.
So a lot of that is correct. 1 in 5 children are at increased risk for high blood pressure. 1 in 5 children is believed to be obese, and so that just means having a weight that does not correspond quite with their height. Being obese greatly increases your chance of becoming hypertensive. And you're right, at 3 years of age, that is when we start screening routinely at the regular pediatrics visits year after year.
Would you say that you're seeing a lot more of these adult onset illnesses among children? We've seen children developing type 2 diabetes, which used to be something that was pretty much just for adults.
I do think that's a fair statement that we're starting to see some of the more common adult illnesses affect children, particularly in the teenage years. Going back to obesity, we think about 1 in 5 kids is actually obese. As it pertains to definition, hypertension, its number is probably a little closer to 1 in 10, but that number, 1 in 10, is still higher than what it used to be. So it's a troubling trend in pediatrics. You mentioned type 2 diabetes, we've mentioned high blood pressure. There are other conditions as well, whether they be endocrinology-associated conditions or gastrointestinal, some of the reflux issues. And a lot of this has to do, again, to diet. So some of the foods that kids are eating, whether it be hot Cheetos. We all ate sunflower seeds, but sometimes it is the amount that you're eating as well. And interestingly, some of the drinks or beverages that we're consuming, that plays a role as well.
What can be done? I mean, how do you counsel parents about getting their kids on that right path to better health?
Absolutely. Well, a couple things come to mind. One, as parents, first we have to take our child actually into the doctor's office and make sure that they're being seen routinely. That's on the parents' end. On the doctor's end, because we've got some skin in the game as well, it's actually screening for these things. So sometimes the day is so rushed that we, the doctors, we might skim over the blood pressure and not see that they're at this borderline level or even high level. So it's up to the doctors to recognize it. But once child is in office, 2, once it's appreciated that levels are out of whack, a discussion needs to be had. And I think physicians should ask the family, what are their goals for their child? Is this something that's important to them right now? Because if it's not, then I might start right there with trying to get the family to have an interest in this as opposed to prescribing 4 or 5 different things they could do at home. So 1, it's going to be getting the family engaged. And then 2, once they're engaged, getting the child engaged. Once we have that, now we can start with our plan of different things that we can do. And a lot of it is going to center around diet and exercise.
What made you want to become a pediatrician?
Pediatricians, they love children. They just love children. With that said, the part that gets us into trouble is our affinity or lack of affinity towards adults. Okay, so the kids, that's the easy part. Getting a kid to want to lose weight, I could do that. I could do some Jedi mind tricks to the kid to make them want to lose weight. They want to pick up love interest as they get older. I could do that for the child. Sometimes it's the parent that is the challenge for a pediatrician, but that is why we go into this, is actually for that challenge. For me specifically, why I wanted to get into pediatrics, I love fun. My wife calls me a goofball. I accept it. It is the closest thing to me that merges science with being a teacher, because that's something else that I also considered as a profession, becoming a high school, middle school, elementary school teacher, with ultimately being able to make a change in the community. So science plus teaching plus impact on community. A career in pediatrics is something that I thought was perfect for me. But I didn't always want to be a general practitioner pediatrician. I had other aspirations earlier on.
And what might those be?
I wanted to be a pediatric neurosurgeon, actually. So growing up here in Baltimore, Dr. Ben Carson, he had a book called Gifted Hands, and it was perhaps required reading. I actually think a family member gave it to me before it became a school required reading. And I was just intrigued to hear his story. Coming up from an inner city town, I want to say he's from Detroit, and his family faced incredible odds, and he had learning difficulties early on, and he overcame those obstacles to become a world-renowned neurosurgeon. My story does not mirror that necessarily exactly. I am from an inner city of Baltimore, but grew up in what many would call a middle-class neighborhood. Both parents in the household, both parents have advanced degrees, so my story wasn't exactly like Dr. Carson's, but hearing him successfully do something that had not been done, which was separate conjoined twins at the time, or at least had not been done here in the U.S., to do that successfully, to have that impact, that was something that certainly stuck out to me. And I said, oh, I want to do that. It wasn't until the first year of medical school, when you get into the neuroanatomy unit, that I quickly lost interest and said, oh yeah, this is not for me. However, still that love for children, having fun, and making a difference with that population is something that has always been close to my heart.
Did you have a mentor who helped you, whether it was get into medicine itself or make your decision about what specialty, or just someone who's had a huge influence in your life?
I had a village, fortunately. Mentorship is so important for everyone, specifically people of color, children of color. Immediately who comes to mind are my parents. My mom's a teacher. She's retired now, taught in Baltimore City. My father works for the government, and he too is retired. But just seeing them get up, put clothes on, go to work. My father, wore suits. It has an impact whether you know it or not as a child. I hope I'm having the same impact on my son and my daughter, who see me get ready to come to work. There's
the saying that any child who has to look across any further than the dinner table or the kitchen table for a role model is a child who's got a problem. So, and it sounds like you were often looking across the dinner table to see your parents and then your whole extended family for that type of support.
It's a blessing. Some of the stories that we hear upstairs in the office from day to day, and where we have to get social work consults, I say, my goodness, if I had these same deck of cards, would the outcome be the same here? And I'm quite confident that the outcome would not necessarily be the same. And so certainly it's a blessing indeed to be able to look across the dinner table and have those positive influences.
It sounds like you pretty well had set from the beginning that you were going to wind up in medicine. Was that always the case, or was there anything else that really was sort of pulling you in another direction?
There was something pulling me in another direction. Can I show you something?
You may show me something.
Right around, so I have a 4-year-old son, and right around the time I was 5, I saw a movie, and this movie had a deep, very profound impact on me. And I don't know if you know what this is, but this is to the airplane, but it's not just any airplane. This is a F-14 Tomcat flown by Maverick in this movie called Top Gun. And maybe, perhaps I was too young to be watching this movie at 5 or 6, so it goes back to that same village. I wanted to be a fighter pilot growing up for the longest time. And so probably around, again, 5 or 6, I had this fascination with aviation. Computers, we didn't quite have video games quite yet, or video games that focus like this. Computers had something called Flight Simulator, and that was the most realistic experience that you could get to being a pilot. And you could have a joystick, which was just like a cockpit. And my parents could tell you I was glued to this thing, trying to beat every mission and fly. And it's a pretty boring game when you look back at it now. It's just the same screen, and I call those things. I use that actually for my patients now, which is when I try to ask them what career do they see themselves going into, and some of them say, I don't know, right? And that's okay to me because, you're a kid, right? But I like to ask them a follow-up question. What is that thing that you maybe have interest in and someone might call you weird for, right? They're not validated and call you weird, by the way, but, and so for me, it was when my friends were outside playing whatever, basketball, soccer, I'm at this computer thing trying to, do this. And so this introduced me to aviation, which I still have a profound interest in interest only, not a love for. I would say love for, but I had an experience in a helicopter that was very terrifying. That I said, I'm glad I'm not in aviation. I proposed on a helicopter, and where I thought that was going to be my profession, being a helicopter pilot, it quickly changed after this near-death experience in a helicopter. So
I've heard that they actually have like adult camps for people who want to like fly a fighter jet. Have you ever thought about doing that?
I've been to space camp before.
When did you go to space camp?
This was 14, and so fortunately it's not like a year or two ago. This was when I was 14 years old. NASA has a space camp in Huntsville, Alabama.
Oh, I know it well.
Oh, yeah. So,
I was there in 1990.
Oh, very nice. So, very nice. So I was 94 that I was there.
I just missed you.
Yep. And again, that was my parents' awareness of their child's interests. Mm-hmm. And continuing to pour into that, right? So
and cultivated that
and
for
cultivating
you.
it. And so I had that experience. In the high school that I chose here in Baltimore Polytechnic Institute, my choosing that high school was for a career in aviation. They have a very robust ROTC, Air Force ROTC program, so it's kind of like a pipeline for Air Force or NASA. So I started in that trajectory. For adult training, adult camps, again, I don't quite have that interest anymore. So I like to look at them in the sky. My son points at them. I play missions at my house with my sons and his toys, but that's about it.
Your children are pretty young still.
They are. 4-year-old son, 2-year-old daughter.
So you're still pretty kind of new to the father game. So how has it helped you as a pediatrician?
I think it has made me a significantly better pediatrician. I'm able to relate to families, everything from the family who's not getting any sleep with their newborn to the 2-month-old who has colic and how frustrating that could be for a mom or a dad, to the vaccine hesitant parent, to be able to say, hey, I've given these same vaccines to my child at this age, to your child having what seems like a mild illness, a cold, but you, the parent, the new parent, still having tremendous worry and anxiety about it. Those were all things I did not have before being a parent. So one of the greatest things that's happened to me since being a pediatrician in 2007, finishing residency in 2010, one of the greatest things that happened to me was becoming a parent of a son in 2016 and then of a daughter in 2018. The difference being my daughter, the 2-year-old, is completely different than my son, 4-year-old. And if I just had my 4-year-old son, I would still be missing out on certain things because my daughter is a completely different, we don't call our children animals, but she's a completely different entity than my son is.
Well, Dr. Woods, we're going to take a break and we'll be back after these messages.